goggles on, I have my coat on and that. I would entertain, oh gosh, I looked it up and there's all these cameras. So I got my, I walk into my room, I check my order, make sure that I have an order for an IV. And I go in, I introduce myself. It's like, hi, my name is Summer. I'm gonna be your nurse today. Can I get your name and date of birth? And you can also check on their bracelet too, just to make sure that yes, I have the right patient. And you just say the doctor has ordered an IV for you. Can you tell me, are you allergic to anything like latex, chlorhexidine, alcohol, anything that I'm going to be using to start your IV? And they'll say no. Just say great. And then you'll say, is there any reason why I can't use this arm? Have you had anything like a stroke in this arm, a mastectomy with lymph nodes removed, anything like that that would say, I can't use this arm? And they'll say, nope, you can use it. And I'll say, great. So then I go ahead and get my supplies done. If I haven't already, go ahead and do my hand hygiene with everything. And then I'm just gonna look for a vein first. So I'm going to put my tourniquet on, again about 4 to 6 inches away. And make sure you can do 2 fingers underneath it. Yep. And still got a radial pulse. So yep. And again, I've got 2 minutes to do this, and I'm just kind of waiting to see if anything's popping out that I like. So let's say this like cephalic vein right here, it's starting to pop out. I really like that one. So I know that that's kind of where I'm going. So I can go ahead and pop the tourniquet, let their arm kind of relax a little bit. Go ahead and put some gloves on. And then you've got your IV start kit, and that should have just about everything that you need in there. I've got an extra tourniquet that I don't need. Extra gloves. Again, I've got my tape. Tear that little piece off. And then I've just got it ready to go for whenever I need it. I'm not gonna put it on the bedside table or anything like that. And then I've got my J-loop. And again, this will be in its own packaging. Just kind of pretend it was in its own packaging, and I'm just gonna keep it in its packaging. You always want to prime this because again, you don't want to run that risk of putting air into your vein. And if this is a new flush, pull back on it, because if you try to push it forward when it's brand new, it may kind of geyser up and spurt everywhere. So go ahead and pull back first. Since this will still be sterile, it just came out of its packaging. I'm just going to go ahead and hook it on here. Now, of course, if you touch the hub or anything like that, it's always a good idea to clean that off first. You're just going to push this through until you see some liquid come out. So it's all primed, ready to go. That just hangs out there. I've got my chlorhexidine that I'm going to use to clean the site. It's always a good idea too, if you think, oh, that's a really big vein, to put like a chuck or something underneath you, so you're not making like a big mess on the person either too. I've got my dressing. I'm gonna get that ready to go for me, because a lot of times all of this stuff you do like one-handed with everything. I've got my catheter here, I've got my J-loop and all that, and I'm ready to go. So now that everything is ready, everything is set up, I'm ready to tie my tourniquet again. Again, about 2 minutes. Again, make sure that I can fit 2 fingers underneath. Make sure I still got a radial pulse. Yep, good to go. And then when I go ahead and clean my vein, I'm gonna go back and forth with some friction. Friction can cause heat, it can cause that vein to kind of like that. You can have the person dangle their arm or make a fist in and out for it to pop up more if you can't really see it. It's clean, you can't touch it anymore. So that's kind of the trick. And again, what I like to do is that if I have, like let's say this little gauze piece or like a little piece of chlorhexidine square or something, I'll kind of make an arrow and be like, I'm gonna go right there, kind of a thing. So that way if I can't see the vein, I at least have some sort of a clue of where I'm going with it. And so, got all my stuff. So I'm just going to kind of stabilize that vein by kind of holding underneath the arm. Should be facing up on you. And you're not going to go very deep. It's relatively shallow, probably about 5, 10, 15 degrees with that, depending on your person. And then you could warm them, it's like, okay, big stick, and you're going to go in. Whenever you make it into the vein, again, you're going to feel like kind of a popping sensation. And you're going to see this chamber here fill up with some blood. And once you do that, you know, okay, I'm in the vein. So as you're doing that, you'll pull this out. The safety will engage on you, or you may have to engage it yourself, depending on which kind of AccuCath you use. I'm going to go ahead and hook my J-loop to it. And as you can see with my hands, I'm not really touching the side itself that it's inserting. I'm just going around it. Once you have your J-loop on, you don't have to hold pressure anymore because you're not worried about blood. And just make sure that you can flush it, and maybe pull back some blood too, just to make sure that you're in the vein. If it flushes good, you can get some blood return, you know, don't see any infiltration or anything like that, then we're good to go. So the last thing you want to do is to take your dressing for your colors, whether like so.